Good morning to board member Nicole Thibault. If you'd like, we can do a mic check.
Morning, how are you?
I'm good. How are you?
Good,
Oh,
thank
and there you are on video as well. Perfect.
you.
You're welcome.
Okay, it's 9 a.m. Everybody, we will get started. Welcome to the March 26, 2025 board meeting. My name is Sung Oh, president of the board. Before we convene, I would like to welcome back Ricardo Sanchez to the board. We are so excited Ricardo is back on this board. He has served for many years. Ricardo previously served on the board as a public member starting in around 2014 and served until June 1st of 2023. Ricardo, it is great to have you back on the board. And I would also like to announce that Indira Cameron Banks is no longer on the board. Indira was appointed to another commission. We thank Indira for her service on this board. I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. To ensure the board has sufficient time to complete all of its necessary work, I have advised the meeting moderator to allot 2 minutes to each individual providing comments. We'll begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions. Moderator Ann?
Thank you. This is the moderator. If anyone would like to make a comment during the public comment period, you'll have 2 minutes to speak, and we'll give you a 10-second warning. We ask people to speak only once per agenda item. We will display instructions on the screen. The primary form of requesting to comment is to click on the hand icon. That's typically at the bottom of your computer screen in your WebEx app, or if you're on a mobile device, it may be behind the 3-dot other options. And if you're a call-in user, you can press *3 to raise your hand. We will do our best to take comments in the order submitted, and we will give warning when your time is up. Thank you.
Thank you, Moderator Ann. In the event of an emergency that requires a room to be evacuated, knock on wood, hopefully that won't happen, there are 2 exits, the double doors in the back of the room that everyone entered from, as well as the exit door located to my left. It is to audience's right. If exiting through this door, exiting through the single exit door on my left, please note that this door does not immediately lead to the outside. Rather, you will need to then exit the building through double doors. I'd like to take a roll call to establish a quorum. Jesse Crowley is not here. Trevor Chandler?
Public member present.
Thank you, Trevor. Renee Barker?
Licensee member present.
Thank you, Renee. Jeff Hughes?
Public member present.
Thank you, Jeff. KK Jha, I don't believe KK is joining. Jay Newell, I don't believe Jay is here today. Ricardo Sanchez.
Ricardo Sanchez, public member.
Thank you, Ricardo. Satinder Sandhu.
Licensee member present.
Satinder Maria Serpa.
Licensee member present.
Thank you, Maria Nicole Tebow.
Licensee member present, and there are no persons over the age of 18 in the room with me at this time.
Thank you, Nicole. Quorum, and I am here. A quorum has been established. I truly appreciate everyone's time and commitment to the board and California consumers. Members, truly appreciate you making changes to your schedules to accommodate our meeting today. I ask everyone participating today to be respectful of the work before the board. We encourage participation by members of the public throughout our meetings at appropriate times. The board respectfully requests that when comments are provided, they're done so in a professional manner, consistent with how the board conducts its business. And before we move to the next agenda item, I would like to remind members participating via WebEx to please remain visible on camera throughout the open portion of today's meeting. If you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. We're moving right on to agenda item 2, discussion and possible action related, including possible adoption of proposed regulation, Title 16, California Code of Regulation, repeal of Section 1708.3, 1708.4, 1735, and 1751, and an addition of Section 1735, 1736, 1737, and 1738, related to compounded drug preparations, hazardous drugs, and radiopharmaceuticals, including review of comments received during the 15-day comment period to 4th modified text. Members, first on our agenda is review of comments received in response to the board's 15-day comment period on the board's proposed 4th modified text for the proposed regulations regarding sterile and non-sterile compounding, hazardous drugs, and radiopharmaceuticals. History of the rulemaking is detailed in the meeting materials and the initial statement of reasons, so I will not restate. But we'll just remind members that most recently, during March 6, 2025 board meeting, the board voted to further amend the proposed regulation text based on comments received. Immediately following the March 6, 2025 board meeting, the 4th modified text was released for a 15-day comment period, which ended on March 21st, 2025. Consistent with delegated authority, members Serpa and Barker reviewed comments received and worked with staff to provide recommendations to our consideration today. Thank you again to Dr. Serpa and Dr. Barker for all of your work, and your expertise and leadership have provided tremendous support to members as we have navigated this very complex area of pharmacy practice. I've carefully reviewed the comments and look forward to our discussion and action. I note that there are no recommendations to further modify the text. After reviewing all of the meeting materials, I also agree that no further changes to the proposed text are appropriate at this time. Members, we have considered the proposed regulations on numerous occasions. I believe our thoughtful consideration of comments have led to some very significant changes. I'm comfortable with the staff recommendation. All right, members, do you have any questions or comments? I would like to also entertain a motion and note a possible motion is included in the meeting materials and displayed in the meeting slide. Members?
I think we were waiting for people to speak up rather than me
Any
speak up first.
comments? Okay.
We've discussed this at great length, and I think everyone knows my opinion, and I support the current regulations as written. So I would be happy to make a motion. First, to accept the board's staff recommended responses to the comments on the fourth modified text received during the 15-day comment period as the responses of the board as presented. Adopt the fourth modified text that was dated 2/28/25. And thirdly, authorize the executive officer to take all steps necessary to complete the rulemaking process. Delegate to the executive officer the authority to make technical or non-substantive changes that may be required by control agencies to complete the rulemaking file. So moved.
Thank you, Maria. Thanks for the motion. Do we have a second?
I'll second.
Thank you, Renee. I appreciate that. With a motion and a second. Members, do we have comments? Anyone want to make comment before we go for public comment?
This is Renee. I really want to reiterate what Maria just said. This has been, a lot of discussion, which has been really great, and the feedback has been, and responses and proposed changes have been very thoughtful and informative, and it's just kind of inspiring to hear this feedback. And I do believe that for each of the documents, which are just really so important, and the regulation text is really reflective of this long journey that I think has been very worthwhile.
Thank you, Renee. Anyone else? I'm going to make sure everyone has an opportunity to comment after we hear public comment today. So just wanted to make sure we're all on the same page there. Okay, we're ready for public comment in this case. We are ready for public comment in Sacramento. So we'll start here. Just a reminder that it's 2 minutes per person today. Ready for Sacramento? Make sure to turn on the microphone, Dr. Common. Yeah, thank you so much. There you go.
Good morning. I am Marie Kottman, a compounding only pharmacy owner and PIC for almost 20 years. I've addressed this board on many occasions, and I am thankful for the opportunity to do so again today. We have a mutual goal of ensuring high quality, safe, and effective compounded medications are provided to the patients of California. As such, regulations promulgated by you should serve to achieve this goal and do so with the rigor of scientific evidence that supports the rationale for implementation. New regulations should balance the value of the improvement in care against the inevitable costs that will be passed on to the patients. While I appreciate the efforts of this board and the staff, I still have significant concerns about the lack of clarity on how PIC is to achieve full compliance with this body of regulations, and in some instances, the lack of scientific reasoning to justify implementation. You have heard me advocate against adopting USP as law because it is written as a guidance document and a standard of practice, not as a regulation. Despite my efforts, USP is our law in California, and after a multi-year process, maybe now you can see why it shouldn't be. The proposed fourth modified text does not provide the clarity that you had hoped for. However, it may have the potential to push good compounders out of the compounding space, which will further limit access to patients who need us most. Be brave enough today to say no. Please make a motion to repeal the relevant compounding sections as listed in the fourth modified text without the addition of any revision or additional rules. Don't be afraid to do the right thing for the patients who need compounded medications. Thank you.
Thank you for the comments. Sacramento?
Good morning to the board. I appreciate the chance to speak to you. As a California Fire Battalion Chief, it has been my job to ensure the health and safety of my people. Having seen the results of glutathione therapy on toxin reduction and cancer risk reduction, I've been striving to make it more widely available to them. And so I'm heartened by the recent language changes to remove the regulations on glutathione by this board. However, it still remains unavailable for home use by my people because of enforcement action on the part of the board, even in advance of these regulations having been passed. And so I would ask the board to address this. The FDA interim guidelines have made it clear that patient access to these medications should not be restricted during the time of evaluation. And so I ask you to honor that and help to make glutathione available for the people that need it the most. Thank you.
Thank you for the comments. Sacramento?
Morning.
Morning.
My name is Bob Molesworth, Sonoma County firefighter for over 20 years. Come up here several times now to speak to the board, and I appreciate the opportunity. But it seems to be it's kind of a broken record with comments of the board and the kicking the can down the road. Some people are in favor of one thing, some people are in favor of another, but it's slightly confusing. Not to be disrespectful, but I think the board needs to take a look at their vision and their mission statement, and to take those statements really to heart, and to do what's best for the citizens, the taxpayers of California. I'm a compounded glutathione patient. It's worked really well for me. And as I don't know the science completely, but it has worked on me very successfully. And I appreciated the opportunity to take it. Currently, there are still thousands of firefighters in the state that are taking it to provide health and wellness for them. If you take that away, it's what's the future of the fire service or the public safety, or just the citizens of California that aren't going to be able to have access to that. So I ask again to, and then echoing the last two statements of, do the right thing and stop kicking the can down the road. Thank you.
Thank you for the comments.
Good morning to the board. My name is Dr. Chris Holder. I'm a physician in Santa Rosa, California. I'm a toxicology specialist and mostly work with cancer patients, but have a distinct interest in actually preventing cancer. And early in my career, I came across glutathione, methylcobalamin, and many other naturally occurring compounds that are excellent for detoxification. These are things that your body makes. They're typically very safe, and when compounded effectively and cleanly, are very safe to use. I'm very concerned about the supply issues. When we had our Tubbs fire in 2017, there wasn't a supply issue. I was able to get as much as I needed from the various sources that existed at the time. In many cases, these pharmacists delivered it straight to my clinic or to where we were actively treating firefighters and civilians that were affected by the toxicity of the smoke. I'm exhausted because one of the things that's changed is I can't write it patient specific, and that's what I used to do. I've been in LA almost every weekend except for a few since that fire happened. There were 7,500 firefighters that responded to that fire. It would be much more efficient if I could write them scripts than having to be in the room myself and have other physicians there, because I do think it's a very safe thing to administer. And we do screen these patients before we administer it to them. So that's my request. There's too few doctors to treat all these firefighters in this way, unless I can actually write the prescriptions to them personally.
10 seconds.
And please, as you strive to regulate this industry, please don't eradicate compounding pharmacy, and look at how the pharmacists feel about this board and the regulation. Thank you.
Thank you for the comment.
Good morning, friends. Good to be with you all again. Oh, on the bottom.
There you go. Thank you.
Perfect. Try that again.
You're good.
Yeah. Okay. Thank you so much. It's good to be with you all again. Feels like being home at this point. It's been a long year. I want to speak to a couple of things, reiterating what Fire Engineer Bob Molesworth shared, which is that he has been a recipient of this treatment. And firefighters don't like to talk about themselves, but I will tell you, he started our 12-week firefighter detoxification pilot program protocol with 33 elevated toxins above 75th percentile. Any one of those, our treating doctor who just spoke, Dr. Holder, would tell you is cause for cancer concern. 16 of those 33 red toxins were above the 95th percentile, including one PFAS chemical that was 14 times the 95th percentile. We reduced it by 96%. So we started with 16 in the red. He finished with just 2 left in his body. He had been diagnosed with bladder cancer twice in the 2 years preceding this treatment, and he retested on the other end of treatment and was declared cancer-free for the first time in 3 years. Well, we keep hearing that patient-specific glutathione is still available. Where? Our doctors can't get it. We're now more than halfway through the 3rd round of our pilot program. These firefighters are supposed to be nebulizing at home 3 to 4 times a week. They can't do it. They have 1 shot once a week in a doctor's presence. For them to get their prescription of 30 to 60 doses, it would cost
10 seconds.
750% more if they could even feasibly do it. They can't. Finally, board members, please start asking more questions about enforcement practices. Thank you so much.
Thank you so much.
Good morning, President O and members of the California Board of Pharmacy. My name is Dr. Seha, and I'm here not only as a physician, but as a cancer survivor that has turned into a cancer thriver using compounded sterile products such as glutathione. I really appreciate what it takes to write regulations. I know it's a challenging task, and I know it's difficult. Over the past few years, you have been working on this, and I really appreciate the effort that takes. However, I do believe that if these regulations are passed, and even before they've been passed, they're already causing an active harm. As a lot of the doctors have mentioned here today, it is becoming increasingly difficult to get access to glutathione among other compounded sterile products. And if these regulations pass, it'll become even more difficult. And that puts patients like me, cancer survivors, people who are trying to prevent cancer, chronically ill patients, amongst other vulnerable populations, including firefighters that you've heard from multiple times over the past few months, in a very precarious situation. And harm is not just direct harm. It's also taking away access as something that could cause a benefit to patients, as this has. And I know I'm a young doctor, but people with much more clinical experience than I have been using these compounded sterile products for decades safely. There have been only few instances of unsafe products, and those have been pinpointed to very specific things. And so there's not a widespread enough problem to warrant taking away this really important medication that is not only life-changing for people, but life-saving. And I really just ask you all, board members, to really consider what the potential harm of is if these
10
products can no
seconds.
longer be used. And patients are really cute. They know the risk and the benefits of compounded sterile products, and we should respect patient autonomy on
Time.
that level. Thank you.
Thank you for the comments. Okay, do we have any other folks in Sacramento before we go to WebEx? Going once, going twice, going. All right, ready for WebEx, moderator Ann?
Thank you. If anyone would like to make a comment, you may click the hand icon to raise your hand, and our call-in users may press *3 to raise their hand. We will do our best to take take requests for comment in the order that we receive them. First is someone logged into WebEx as Paul Hennessy. Paul, I'm going to send you a request to unmute, and you'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Hi, I'd just like to echo the other public comments. In short, your proposed regulations are dangerous and reckless. I'm offended to see that after months of public comment, the board is still attempting to justify harmful, broadly opposed regulations that go around the FDA and exceed USB standards. The LA fires are further proof that patients need access to treatments such as glutathione and others. Yet your president is pressuring other board members to disregard public input. Instead of listening to patients begging for access to amazing treatments, you are taking a page from the RFK Jr. playbook by steamrolling and lying to the public. Cancer is the leading cause of death among firefighters, yet glutathione has demonstrated promising results in reversing toxicity. Patients with Lyme disease and long COVID have depleted glutathione levels as well. B12 and NAD+ infusions are also beneficial. So why are we here begging you for access for months? You should all be ashamed. You've wasted patients' time, their limited energy, and put lives at risk for no reason. The modified text does not provide clarity and further limits access. Allow for writing prescriptions over requiring a doctor to spend their limited time with the patient. I'm opposed to the current limitations and urge you to allow broad access like every other state in the country does, and stop delaying this with endless discussions. Thanks.
Thank you for the comment.
And this is the moderator. Our next in line to comment is Councilmember Marjorie Morgenstern. I will send you a request to unmute your microphone, and you'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Hello, my name is Marjorie Morgenstern, and I am a council member from Cloverdale, California, which is located in Sonoma County. In Sonoma County, we have a very scary fire season every year, and we really appreciate all our firefighters in Sonoma County and the rest of the firefighters in California as well. Please put patients before politics. Glutathione, along with B12 injections, have helped me tremendously with Lyme disease treatment. Your proposed regulations are dangerous, especially for firefighters. Please do the right thing and listen to public comment. Thank you, and please end this farce now.
Thank you for the comment.
And this is the moderator. Our next in line to comment is Candace Wayrock. Candace, I'm going to send you a request to unmute your microphone. You're unmuted. Go ahead.
Hello, my name is Candace Wyrock. I am from Patterson, California. I serve on a multitude of nonprofit boards and commissions and in capacities that allow me to work very closely with both our local paid fire department as well as our countywide volunteer fire department. We both entities have sent firefighters in the last year to wildfires across our entire state. And as someone that works closely with the community, it hurts to think that you guys would try to regulate something that keeps our husbands, uncles, aunts, wives, these firefighters from being able to live a long and healthy life. They continually risk their lives in order to keep the rest of us safe, keep our property safe. We, in 2020, had a giant wildfire in the canyon right above our city, and multiple fire agencies from across the state came to fight that. So we've seen it both firsthand from our firefighters helping others, and then the firefighters in the state helping us. So I just would like to urge you to look at it from a family's perspective, look at it from a community's perspective, and understand that this medication could be life-saving in so many capacities, and to make it non-accessible to them is I almost feel like sorry, can't think of the word, but what I'm trying to say is it feels insulting to say that their lives aren't worth having access to this medication. Thank you so much.
Thank you for the comment.
And our next request for comment is from someone logged in as Paris. Paris, I'm going to send you a request to unmute. You'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Yeah, so I'm actually a medical provider based in Beverly Hills. And every year, you guys, the FDA, are making it more difficult for people in California to get access to life-saving treatments. Glutathione is something our body makes. NAD already in our body. B12, not so much, but there are deficiencies. We have documented proof that these things help people with chronic conditions. It's so frustrating as a medical provider that this is the only state where we can't get access to things that we need. And the part of the problem is big pharma cannot monetize off of these products. And so, just like someone else said, please stop politicizing this. This is ridiculous. What would you do if your family needed these treatments? And almost every day, I get emails from the FDA saying, hey, an FDA approved product has contamination with benzene, or there's metal shards in it. So, why are we acting like FDA approved products coming from FDA facilities are perfect and don't cause harm? They do. So, what's fair is fair. Please stop destroying California. This is insane.
Thank you for the comment.
Thank you. And our next request is from Sarah Johnson. Sarah, I'll send you a request to unmute, and you'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
I'm Sarah Johnson, and I have post-vac long COVID and ME/CFS. I've been disabled for 3 years, and nothing exists to help me or millions of others. The proposed regulations would function as a de facto ban on the critical medications like glutathione, methylcobalamin, NAD+, these treatments that patients with ME/CFS and long COVID rely on because no FDA-approved alternatives exist. The regulations directly violate the Americans with Disabilities Act by denying disabled patients access to necessary medical care. They also conflict with FDA and USP standards, which give compounding flexibility when patient-specific needs cannot be met with commercial drugs. Instead of following federal guidance, the board is imposing rigid barriers that harm the people it should be protecting. At the Sunset Review hearing, the board's chair claimed that misinformation was causing confusion, and that is false. Hundreds of patients, clinicians, and pharmacists have raised well-documented, legitimate concerns. He also claimed that the board is not banning these substances, yet if pharmacists can no longer legally fill these prescriptions in California when 49 other states can, that is a ban. This process has excluded meaningful input from the people of California who are most affected. These actions violate the ADA and California's Administrative Procedure Act and the Brown Act by lacking proper justification and failing to ensure public transparency. All of this is happening as the federal government is preparing to abolish the Office of Long COVID Research and Practice. At every level, people with long COVID and ME/CFS are being erased. Stripping access to one of the only treatment options available now will cause preventable suffering and death. This is a legal failure, a public health failure, and a moral failure. These regulations must be
10
withdrawn.
seconds.
I thank Dr. Tebow for her visibility. Thank you.
Thank you for the comments.
Our next public comment is from Tennille Davis. Tennille, I'm going to send you a request to unmute. You'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Can you hear me?
Yes.
Oh, thank you. Good morning, President O and members of the board. My name is Tennille Davis, and I'm here on behalf of the Alliance for Pharmacy Compounding. We again urge the board to not move forward with the proposed compounding regulations in their current form. The feedback from pharmacists, physicians, hospitals, academics, and other stakeholders has been consistent. These rules are unworkable, duplicative, and threaten patient access to needed therapies. Yet the board appears poised to move forward without addressing the very real and very well-documented concerns from those on the front lines of patient care. We understand the time already invested in this process, but sunk costs do not justify finalizing regulations that are fundamentally flawed. The burden of rules is not offset by any clear, evidence-based improvements in patient safety. In fact, these rules risk harming patients by restricting access to compounded medications. We are concerned by the board's actions in the field regarding compounding with API and FDA's interim Category 1 and believe patient access will continue to be limited. Actions taken against pharmacies and pharmacists for compounding with API like glutathione and methylcobalamin in the past have created a chilling effect, preventing other pharmacies from providing these vital medications to patients. We respectfully call on the board to pause, convene a task force of pharmacists from diverse practice settings, hospital, academic, rural, and compounding, include USP committee members, engage in genuine collaboration to develop regulations that support both patient safety and patient access. Californians deserve thoughtful, practical regulations. Please step back, listen to healthcare professionals who've spoken up, and put patients first. Thank you.
Thank you so much for the comment.
And this is the moderator. Our next in line to comment is John Gray. John, I'm going to send you a request to unmute. You'll have 2 minutes with a 10-second warning. You're
Hi, good
unmuted.
morning. Thank you. This is John Gray, registered pharmacist with Kaiser Permanente. Thanks for the opportunity to comment. You all have been on the board long enough to have developed a mental model for assessing proposed policy measures. I also have one. While I do not claim that it is unique in any way, I do want to take this opportunity to share my model with you in the context of these proposed regulations. When I'm evaluating a policy measure, I like to think about what problem or problems is the measure attempting to solve for. Based on the available evidence, is the measure likely to do what it claims to do? What are the likely impacts of the measure? And how might others perceive my organization's stance on the measure? Throughout the rulemaking process, we have shown that the USP compounding chapters adequately address the need for evidence-based compounding standards and are already incorporated into California law. We have also demonstrated that there is scant evidence to support the notion that the proposed regulations are likely to make compounding safer. We have highlighted several negative second-order effects that the regulations are likely to precipitate. Finally, I can't comment on the last component of my model, what advancing this regulation might do to the board's reputation, but I do believe that is something that each of you should carefully consider before you vote. As you prepare to vote on whether you believe these regulations should be adopted, I encourage you to critically apply your mental model for evaluating policy measures to the proposed regulations. And if you found anything in my mental model helpful, feel free to borrow from mine as well. For our part, Kaiser Permanente encourages you to vote down the current motion and instead advance an alternative motion, which we have detailed in our letter, to repeal the board's existing compounding regulations and reject the newly proposed regulations. Thank you for the opportunity to comment.
Thank you for the comments.
And next in line is David Marquez. David, I'm going to send you a request to unmute. And as a reminder to all, we have asked that people comment only once per agenda item. David, I'm sending you your request. You're unmuted. Go ahead.
Good afternoon, or good morning, rather. Can you hear me okay?
Yep.
Thank you very much. Thank you for this forum. Thank you once again for giving me a chance to share my story. As I've shared previously, I'm very new to this discussion. But in that time, I have realized this is something that is worthy of my time as a fire captain and as a citizen of California. I'm extremely tired of having to hear the same points brought up over and over again by the people of our state, only to have the can kicked further down the road. I'm tired as a firefighter of being reminded on an annual basis that I have a higher probability of contracting some type of cancer than most workers in the country. I'm tired of coming across treatments that have the potential to help us, to help the people who have lost their lives in this occupation, and only to find out that the doctors who are capable of giving us these treatments are having their hands tied and are asking you as a board how they are going to continue to obtain these treatments. I'm tired of the fact that nobody is calling in and supporting the regulations. I've listened to doctors. I've listened to other patients who I'm also speaking on behalf of. I just heard Kaiser call in. Nobody is supporting this. Although you do have the authority to create these regulations, I believe that you need to look in the mirror and ask yourself if what you are doing is right. And I've said this before. As somebody who was in the Eaton fires,
10 seconds.
Who has seen the benefits of the treatments that compounding pharmacies manufacture and create, I'm asking you to stop over-regulating them and
Time.
please allow them to continue to treat us. Thank you.
Thank you for the comments.
Next commenter is Lucas Evanson. Lucas, I'm going to send you a request to unmute your microphone, and you'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Hello, my name is Lucas Evanson, and I'm speaking on behalf of the California Medical Association. CMA remains disappointed that the staff recommendation continues to reject CMA's proposed language, clarifying that the regulations do not apply to physicians. At the last meeting, Board Counsel summarized Business and Profession Code Section 4170C, stating that the Medical Board of California and other healing arts boards are specifically charged with the enforcement of pharmacy law with respect to their respective licensees. CMA has never disputed this fact. While this statute does limit the Board of Pharmacy's authority to take enforcement action against a physician's license, they do not limit the scope of licensees to whom the board's regulations may apply. Rather, they suggest the opposite. Pharmacy law may at times apply to physicians, and in those situations, the medical board is authorized to take enforcement action if a physician is acting in violation of the law. Through the regulatory process, the Board of Pharmacy is implementing, interpreting, and making specific pharmacy law, which in this case, the medical board has confirmed may influence the standard of care for physicians who are compounding. Allowing pharmacist-centric regulations to influence the physician's standard of care is inappropriate and would harm patient care in California. Since the language continues to fail to clarify that the regulations do not apply to physicians, CMA requests that the board reject this motion and instead withdraw this rulemaking action or do nothing and allow the proposed regulation to expire. Thank you.
Thank you for the comments.
And our next comment is from calling user 5 from the 714 area code. Once I send your request to unmute, you should be able to press *6 to unmute. There you go. You're unmuted. Yep.
Hi, my name is Kevin Adair. I'm a firefighter and worked on the Eden fires. Me and my crew, we were all there that night in the next couple days. And we're all, a little bit shaken up and we're all a little bit scared about the possible repercussions that may, be a consequence of us being on duty that night as it pertains to our health and us possibly getting cancer. And we know that these glutathione nebulized treatments, they could potentially help us, and they've been proven to help people recover from these types of things. And I know that a doctor will write a prescription for these nebulized treatments, but no pharmacist in the country or in the county will make it because there's no open pathway for them to dispense it. And all of these regulations that contain the requirements, they all go above and beyond FDA and USP requirements. They're redundant, unnecessary, cost prohibitive. And in the meantime, all of us here that have been through these fires, we're all still waiting for easy access just so that we can maintain the service that we provide out here for all the citizens and everything. So I'd appreciate it if the board took a real good hard look at the motives behind why these regulations are coming out, and just look at the big picture and look to do the most good for the most people out there. So thank you.
Thank you for the comments.
And our next commenter is call-in user 7, also from 714 area code. I'm going to send you a request to unmute, and you should be able to press *6 to unmute your microphone.
Can you hear me?
Yes, we can.
Oh, wonderful. Thank you. Hi, my name is Phoebe. This is my now third or fourth time calling in for a public comment, and each time I'm just finding it really hard to stay positive. I would like the board to please not move forward with any of these proposed regulations, as everyone who has called into any of these public meetings and showed up to give public comment has requested. No one is asking for this. You continue to waste our time. You are affecting our health negatively. Those of us living with chronic illness who rely on this medication, who are living on pins and needles, figuring out what we might have to do to continue to live with whatever quality of life we have left. Please, this is not necessary. I don't know why you're trying to do this, and I'm done trying to be nice and trying to give you more information. I think a lot of the other callers are doing a great job of that. I'm just pleading to your emotion, to the human part of each of you who may have someone in your family, or let alone yourselves one day, have treatment that actually works for you, be threatened to be taken away by someone who knows nothing about you, when there's no need for it. You literally created this reason. So please, I'm begging you, just as everyone else on these calls have been begging you, do not move forward with these regulations. They are incredibly unpopular and unnecessary. Thank you.
Thank you for the comments.
And our next commenter is Chad Baker. Chad, I'm going to send you a request to unmute your microphone, and you'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Slater RX. Hopefully you guys can hear me. I'm right in the middle of the train station. President O and members of the board, thank you for giving me and others the opportunity to provide comments to the record today. I appreciate so many of you taking up the mantle of flavoring and keeping this important topic front and center over these last few months. I especially want to thank President O, Member Crowley, Member Chop, Member Sandu, and Member Hughes for your strong support on this topic. It has been encouraging to hear. Your support gave everyone a glimmer of hope. Alas, it has all been for naught. Not a single pharmacy owner or operator I've spoken with is planning to bring flavoring back when this language passes. Because of Member Circle and Member Barker's unwillingness to untie flavoring from other totally unrelated pharmacy activities, the exemptions Member Circle claims to be going over a cliff for are meaningless. Not a single pharmacy is going to take advantage of this, especially when you were so close to fulfilling governor's edict to fix this issue. That's why it is incredibly frustrating. You were so close. For the life of me, I will never understand why you couldn't just treat flavoring as its own distinct pharmacy activity. It defies all logic, but I'm done arguing that point. What I've said so far hasn't opened your eyes to the error of your ways. Nothing will. Look forward to this process concluding today. So
And I'm not sure if we lost audio or if you were finished, Mr. Baker.
Oh, I was done. Sorry.
Okay, all right. Thank you so much. Your audio was
Yeah,
choppy. I
no
wanted to make
problem.
sure. Thank
Sorry
you.
about that.
All right.
Thank you
Our
for the
ne-
comments.
Our next request for comment is from Kristen Flowers Chavez. I'm going to send you a request to unmute. And you're unmuted. Go ahead.
Hello,
Chris,
my name.
yes.
Can you hear me? Okay.
Yeah, go
Hi.
ahead.
Thank you. My name is Kristen Flowers Chavez, and I'm from Hellendale, California. This is my first time on here giving a public comment, but I've been following along and I'm worried. I'm here to beg you, please, to not take these sterile compounds away from us here in California. I've listened to many of us speak, from doctors, our public safety personnel, other chronic illness patients who have experienced a better quality of life because of these treatments. I was diagnosed with Lyme disease in 2017, and it's a mess for anyone who lives with Lyme disease, and we know this. And over the last couple years, my body has also had trouble on its own keeping healthy B12 levels. Since being treated with glutathione and B12 methylcobalamin, I have felt such an improvement in my health and mental health from these compounds, helping my body to function and detox. As I sit in the room filled with other patients receiving their treatments, we literally can't stop speaking of how grateful we are of these compounds and the difference they have made in the quality of our lives. I worry for these other patients I've come to know. I worry for our public safety personnel who put their lives on the line for us California citizens, and I worry for myself. I'm just really here to beg you to please do not take this away from us. Please listen to us. Please put yourself in our shoes, and please do the right thing and reconsider these regulations. Thank you.
Thank you for the comments.
And our next request for comment is from call-in user 9, a phone with a 619 area code. We will be sending you a request to unmute, and at that point you should be able to press *6 to unmute yourself.
Hi there.
All right.
My name is Danielle. Hello? Can you hear me?
Yes, we can.
Hi. Okay, great. My name is Danielle. I've lived in California my whole life, and I've never been more upset with my state. It breaks my heart what you're doing to these people. It boggles my mind that you are choosing to line up your pockets instead of allowing these treatments to be available and readily accessible for those in need. If you do go forward with this, I want you to know that karma will come after you. If anyone you love ever needs these treatments and can't access them, I want you to feel that sadness, and I want you to know that you are the one that took that away. Please do the right thing. Stop the corruption and protect the public. Stop wasting our time and do the right thing. Thank you.
Thank you for the comments.
And our next commenter is Brooke. And Brooke, I'm going to send you a request to unmute. And Brooke, you should perhaps see a pop-up. There you go. You're unmuted. Go ahead.
Thank you. Can you hear me?
Yep.
Okay. In 2022, my body shut down after the COVID vaccine, and truthfully, I was given months to live. I began having heart issues and strokes. My CRP shot up to a 27, which is a cancerous level of inflammation. Tingling, numbness, and burning sensations were all over my body, and my left side became weaker than my right, and I was actually in a wheelchair most days and could use a cane on others. I was in bed for over 6 months, and my mom had to come live with me to raise my family. Over the last 2 years, I've been using consistent holistic therapies and IVs, specifically B12 with methylcobalamin, glutathione, and NAD. I can now say I no longer use a wheelchair and I'm able to take care of my children. When we take these supplements orally, the effectiveness decreases dramatically. When we take them intravenously, the effectiveness increases dramatically. This feels criminal to take away these things from me. We have also paid for everything out of pocket with no insurance help to get me these therapies. It is already so expensive, and the added stability requirements would further price out vulnerable patients and drive access out of California entirely. Getting these nutrients in my body has helped me to be able to take care of my family and help me heal. I feel that legislation wants this banned is solely because they don't get financial incentives when people choose these options. The board should be focused on protecting patients from actual harm and the numerous FDA-approved pharmaceuticals that cause hundreds and thousands of deaths per year. Instead, you are focused on eliminating safe antioxidants and vitamins. Also, the only people who stand to benefit from these regulations is the large pharmaceutical companies. So why are you doing this?
Thank you for the comment.
All right, our next request for comment is from Crystal A. Frost. Crystal, I'm going to send you a request to unmute your microphone. You're unmuted. Go ahead.
Hi, I'm Crystal Frost. You all know me. I'm the founder of Stop the Bob. I want to start by reminding board members that this entire process has crossed many ethical and legal lines from the start. Before this rules package was introduced, 8 times pharmacies were penalized or shut down for producing Category 1 compounds, even after judges found them innocent. One was pressured into becoming a 503B through intimidation. That's not regulation, it's just abuse. Board leadership have repeatedly misled the public and other board members. They said these treatments aren't available in other states, which is false. We've confirmed with dozens of pharmacies nationwide that California is the only one enforcing underground rules like this. Many times leadership reiterated this lie that the regs don't exceed USP standards, but this is also false. Dozens of professionals have shown where they do time and time again. Today, you adopted, or you're going to try to adopt, the February 28th text, which is proof that the most recent written comment period was just a ruse. I don't talk about my own illnesses, but I can tell you I am discouraged and I am exhausted. You denied accommodations even to people who have told me, Stop the Bob, that people requested reasonable accommodations during other board meetings and you denied them. You're ignoring thousands of comments. You are just wearing people down. You only struck the stability testing language 5 days before your sunset review hearing when legislators started paying attention. So on behalf of all 11,000 petition signers, we ask this board to please reject the rules package. Board members, I know you're good people. Please just reject it. Restore access to Category 1 compounds, end underground enforcement that's already harming us, adopt and stop exceeding USP standards, follow FDA interims policy, which states not to disrupt patient care while the books list is under development, clarify language to
10
prevent
seconds.
board overreach, and most urgently, please make a motion to just repeal this text. We're sick patients, unlike many incredible doctors and pharmacists who have business interests here. Our lives are on the line.
Apologies, time was up.
Thank you for the comments.
Our next commenter is Lindsay Marquez. And as a reminder to the rest, if you do have a request for comment, you can raise your hand by clicking on the hand icon. We are running low on our list, so just get yourself in line if you'd like to. And Lindsay, I'm sending you a request to unmute. You'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Can you hear me?
Yep. Yes, we can.
Hello?
Yes, we can hear you. Go ahead.
Hi, this is my son, 4 months old, in the background. I'm calling on behalf of my brother, David Marquez, who has courageously stepped out and put his voice out there, along with all of the firefighters, as well as every single patient who has called in begging for their life. The last time that I was in this meeting, there were comments made like, you need to do more research and it's not a vitamin, and this coloring stuff and the regulations put on the pharmacists. And as a school teacher and a school pharmacist, it just sounds, or school counselor, it sounds just so redundant and ambiguous and everything that is wrong with the world. I'm begging you to please listen to the medical professionals out there who are on the actual front lines and not sitting behind a desk. They're the ones that are sacrificing their lives. And the 2,700 firefighters should have been enough data for you all to been able to see that this is helping people. This is helping people. I just don't understand the why behind why 49 other states in our country. That is just something I can't wrap my head around. I'll never be able to wrap my head around it. My parents have been in business their entire life, and honestly, that's all I can think of is that it just comes down to corruption and money. And that is something that will be, I hope, taken very, very, very seriously in your minds right before you make this choice and decision to vote against. I think the 3 board members who have voted against this regulation, I pray and hope that the
10
rest of you
seconds.
who are listening will look past all of the confusion of the law and just start thinking about how this is going to affect the lives of people. This is going.
Thank you for the comments.
Our next commenter in line is Joanna Hueso. Joanna, I'm going to send you a request to unmute, and you'll have 2 minutes with a 10-second warning. And you're unmuted. Go ahead.
Good morning, and thank you for taking my call. This is my 3rd time on with this board, and I'm truthfully exhausted. So I can only imagine how all firefighters, patients, and the man I love feel who are seeking this treatment. I would like to express some appreciation for all the concessions you've made with the regulations, but also acknowledge that firefighters still have not been able to self-administer this treatment. It's disturbing and frustrating that our firefighters cannot receive a prescription for this substance to use at home and on a daily basis. Having restrictions should not be a question. This board's behavior is baffling and unjust, and as a result, patients and firefighters are needlessly suffering. They deserve to have access. Our first responders should not spend their lives helping others only to have their own lives cut short. I urge you board members to ask your executive officer hard questions about what her enforcement staff has done to scare pharmacists away from the compounding category 1 treatments like glutathione. I urge you once again to reconsider when voting on this proposed regulation. Thank you for your time.
Thank you for the comments.
And at this point, there are no further requests for comment. Oops, no. All right, a couple more hands went up. Let's see. Next in line is Lilac Mendelovic. I'm going to send you a request to unmute, and then you'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Hello, can you hear me?
Yes.
So I've been living in Los Angeles through the fires, and I'm also a chronically ill patient whose life was immeasurably improved by glutathione. It's my 3rd or 4th time commenting with the board. Honestly, I didn't expect to get emotional about this, but it just feels so frustrating that all of us keep telling you that we need these drugs. The firefighters need these drugs after living through the LA fires. We all are just so scared for our firefighters, and we want them to have these treatments and be able to take them home and nebulize at home, something that can save their lives from cancers, as well as other residents and people that live in the fire areas. These are the kind of treatments that could save so many lives, and it just feels very frustrating that all of our pleas seem to be falling on deaf ears. Sorry. We urge you and we beg you to please vote these packages down so that we can all have access to things that can improve our lives and our health. We appreciate that some attempts to be in the middle have happened, but they are clearly not enough. So please, please vote down this package in regarding to Category 1 compounding. Thank you.
Thank you for the comment.
And our next request for comment is from Stephanie Huang. Stephanie, I'm going to send you a request to unmute. You're unmuted. Go ahead.
Hello, my name is Stephanie Wong, and I'm here today because the Board of Pharmacy's overreach threatens my health, my future, and the well-being of countless patients across California. I have spent years battling long COVID and recently the Eaton fire. When nothing else worked, naturally occurring sterile compounded substances like glutathione and NADIV saved my life. Yet the Board of Pharmacy has decided, without scientific basis, without public support, and without legal authority, that patients like me should no longer have access to these critical therapies. You have ignored federal guidelines, exceeded USP standards, and unlawfully enforced regulations do not even exist. The FDA itself has stated that patient care should not be disrupted while the Category 1 list is under review, yet the board is doing just that. Worse still, the board has deliberately used vague language in an attempt to expand its reach beyond compounding pharmacies and into doctors' offices and hydration clinics, creating a dangerous precedent that has already limited medical professionals' ability to provide care. The Board of Pharmacy is gaslighting the public by claiming that they are not banning these substances, yet patient access is effectively non-existent. What good is it if no one can obtain it? The board is twisting language to hide the fact that their overreach is stripping patients of life-saving treatments to benefit who? Yourselves or Big Pharma or both? Public opposition has been unanimous at every meeting. The people have spoken, yet the board refuses to listen. I'm urging the board to do the right thing. Restore access to Category 1 sterile compounds. End the underground enforcement of compounding pharmacies. Adopt USP standards without exceeding them. Adhere to FDA guidance, and stop disrupting patient care while Category 1 bulk list is under review. Clarify language to prevent overreach into medical offices and hydration clinics. The board's actions are not just bureaucratic decisions. They are life and death matters for people like me. You do not have the right to take away our
10 seconds.
Our autonomy, and our access to care. I ask you to reconsider before irreparable harm is done.
Thank you for the comments.
Our next commenter in line is Mike. And Mike, I'm going to send you a request to unmute. You'll have 2 minutes with a 10-second warning. You're unmuted. Go ahead.
Mike Pearson. I'm a firefighter with Sonoma Valley Fire. I was fortunate enough to go through this treatment, and just very simply looking at the labs, there was a night and day difference before and after. So I'm just here to ask to reconsider this choice, keep it available for future firefighters who have also had the same exposure that I have, and some that have had much more exposure than I have had. So please reconsider this, and thank you for your time.
Thank you for the comments.
And our next commenter is call-in user 20 from the 510 area code. I'm going to send you a request to unmute, and you should be able to press *6 to unmute your microphone. You're unmuted.
Good morning. Hi. I was listening on the phone and I didn't realize my hand wasn't raised. So if anybody's listening on the phone, it's *3 to raise your hand. Anyhow, good morning. Thank you very much for the time and opportunity to comment. My name is Mac Thompson. I'm the president of the Petaluma Firefighters Local 1415 in Sonoma County. I've been a firefighter for 20 years in Sonoma County, and I've responded to fires up and down the state throughout my career. Those fires where you're there for a week or two at a time or longer, as well as just simply going to house fires or vehicle fires or any other toxic exposures where we know that we're responding to or being exposed to carcinogens for a long period and throughout our whole career is stressful. Honestly, I personally do not want to get cancer, and I want to find ways to get those carcinogens out of my body. The IARC, the International Agency for research on cancer, recently upgraded the occupation of firefighting to group 1, which is a known carcinogen or a carcinogenic to humans. I think that's a big deal for international research to realize that our job as firefighters is a known carcinogen, something that you just have to know that you're going in there and you're going to be exposed to these carcinogens. So that being said, that I've chosen to make that choice in my life to sacrifice for the
10
good
seconds.
of public service, I want all the tools that I can have to get those carcinogens out of my body, those toxins out of my body. So I really want you to reconsider and have glutathione available for us.
And
Thank you
apologies,
for the
time was
comment.
up. And our next is call-in user 4 from the 626 area code. I'm going to send you a request to unmute your microphone. You should be able to press *6. And yes, as a reminder, any call-in user who would like to comment can press *3 to raise their hand. And if there are others who've been waiting, this is our last queued up comment. So if you'd like to raise your hand, click on the hand icon. And now call-in user 4, I'm sending you a request so you can press *6. You're unmuted. Go ahead.
Okay. Yeah, my name's Robert Ruiz. I'm with the Pasadena Fire Department. I had the opportunity that was part of the Eaton Fire, virtually from the incipient stage when it started all the way to the end. And we were exposed to toxic gases, smoke, lithium-ion battery smoke, everything that is just huge, has carcinogenic effects. And that's just in that fire, not to include the other fires that we go on. And it's just common sense, guys. If you have something out there that is giving us the ability to help get these toxins out of our body and help potentially prevent us from getting a life-threatening disease, give us that opportunity. Let me be the one to make the choice what I want to do with my body. You know, they were so quick to shove this, the vaccine down our throats and willing to fire us. We'd lose our job, yet it was something that wasn't even tested. It was so rapidly made. And yet you're not giving us the opportunity to put something in our body that's been tested and been being used for over 30, 40, however many years, decades, longer than that stupid vaccine. Please, it's common sense, guys. Just give us the opportunity. Give us access to it. Thank you.
Thank you for the comment.
And our next commenter is call-in user 11. And call-in user 11, I'm going to send you a request to unmute. That should be *6.
Hello?
Yes, go ahead. We can hear you.
Hi, my name is Jason Morales, and I'm with the Pasadena Fire Department. I was also on the Eaton incident. I've been a firefighter for 17 years and been a part of a lot of different fires. And young in my career, I realized that there was some type of cancer, something that was going to affect me. But I never really counted the cost of what that would be until I got married and had a family. And now, looking at the faces of my 14-year-old daughter and my 11-year-old son, and knowing that what's going on and what I'm doing daily, monthly, yearly is slowly killing me. And there isn't something that I knew of early on in my career that I could have done to prevent this so that I could spend the rest of my life or what's left of my life with my family. Everybody that comes to work does an amazing job to complete the mission, but nobody thinks about what's going to happen to the people that love you the most when 30 years is up. I got to use this after the Eaton incident, and I was so used to being just totally kicked down and unable to breathe for weeks. And literally after using this that night, I felt better, and weeks turned into days. And I just want to say, please, please, think about your family, think about the people. As I represent the firefighters that were there, and I represent the firefighters that go home to their families, and even the young ones that can't speak about this, that are here right now, that don't even know that this is taking place.
10 seconds.
I speak on behalf of them. We need this so that they can continue on with this mission. We want to go home to our families.
Time.
We want to go home.
Thank you for the comment.
And at this point, I do not see any other raised hands or requests for comment. Shall I close that public comment period?
Yes, please. Thank you, Anne. I really appreciate everyone's comment. All right, members, bringing discussion back to the board. I would like to make sure every member has an opportunity to say something before we all vote. I'm going to start by saying throughout our discussions on these regulations, I have repeatedly noted that this is a very emotional issue for many. I have personally voiced my very strong desire to ensure Category 1 bulk drug substances remain accessible. I believe we have made our voices very clear and is expected the direction we have made is clear as we move forward. As I stated earlier, I believe the board has been very thoughtful in its consideration of comments received. This consideration is reflected in our actions that resulted in 4 revisions to the proposed modified text, as well as extensive and thorough discussions we've had during the last 7 meetings we've held. The board has steadfastly complied with the rulemaking requirements established in the law, and I believe the board has benefited greatly, I really mean it, from the public engagement and comments received. Again, I sincerely thank the public for such robust engagement, and I truly appreciate your comments. Members, before we vote, I'm gonna just go through everybody just to make sure that everybody has something to say. If not, that's okay. You can say, no, I don't have a comment, no problem, but I just wanna go down the line. Trevor, go ahead.
Thank you, President. So anyone that's been paying attention from the beginning of this process knows that I've been asking particularly tough questions of the process, of the text, and making sure that concerns were thoroughly heard. And part of those conversations, when I started having those with board and staff, resulted in some of these extra meetings. So one thing I want to say is how appreciative I have been of the receptiveness to the concerns that I've raised, and that in regard to comments about having these extra meetings to wear people down is actually exactly the opposite. These extra meetings and extra versions were held in response to the concerns that were raised so that we could further vet and flesh these out. So I'm particularly grateful that we've even obviously this has been a long, intensive process. A lot of people, board members and public and staff have had to commit much additional time. I do believe it was necessary and worth it, and I believe that we have gotten not the perfect product, but a much better product. Regulation and rulemaking is incredibly complex. As we heard just today and in some of the comments I'm reading, we have a lot of people saying, stick to USP, don't go beyond USP. We have people saying that USP is only there to advise. You shouldn't be using it for regulation at all. Then there's obviously the other dynamics regarding enforcement. These are all incredibly important, and there's really passionate, informed arguments on all sides. And our rulemaking process is a way, with the level of transparency that there has been, is a way for us to navigate all of this. as well as navigate the opaqueness at the federal level and the fuzziness at the federal level of how we as a state board navigate Schedule 1 and these other items. I've been really gratified to see the changes in this regarding, the changes in language regarding the stabilization studies, regarding referring to USP, right, and whatnot. And so, do I believe that this is perfect? Absolutely not. Do I believe it makes sure we're taking the right step to fulfill our consumer protection mandate? Yes. Do I believe it is the final step? No. I think this this process is one that we can look at and build upon. And I think the additional conversations that have come about as a result of this process regarding what enforcement looks like, what next steps look like, what we can look to the legislature for. All of those concerns have come about because of the incredibly robust public comment and feedback. And I just want to, I think I could ramble on a little bit more, but I think that's pretty much the extent of my comments.
Thank you, Trevor. We're going to go to Renee. Renee?
Hi. Thank you for that. And I do want to say, just on a personal level, I do have loved ones, friends, coworkers who are dependent on compounded sterile products. And as somebody who compounds, well, not personally, oversees the compounding of sterile products, non-sterile products, hazardous products, I have a heightened awareness for the quality of the product that these loved ones and friends receive. I also, I am always, sorry, I get nervous talking. I'm always, very moved. I know this is an emotional plea. As someone who kind of witnesses on a daily basis what's involved in especially sterile compounding, also knowing the very serious consequences of a compounded product that is not made to the standards, and the detrimental effect that it can have on a person. I think there's some comments that were made, and I think as the consumer safety mandate, the consumer, my loved ones, friends, coworkers who depend on compounded sterile products, there is the assumption, and it was stated, when compounded cleanly and effectively. And then, yes, that is kind of that is really the crux of what we're really trying to ensure to address. Because those instances where that has caused harm, where it's kind of said that there have been a few instances where compounding went wrong, but, well, those people are not here to speak. So, because I work in pediatrics, I work, and my goal is quality products for those who cannot speak. Okay, there's the parents there, somebody who has been harmed by a sterile product, what should have been a sterile product, and are no longer here to speak about it. So, these are very, very serious products, and the consequences of a contaminated product are very serious. And these regulations do have a pathway forward. So in talking about the, this category 1 bulk substance, multiple of them, there is a way forward. The current regulations don't really have a way forward. But these new regulations that are being proposed, they do. And this is what I know the crux of the whole discussion. But there is a pathway forward. And as far as pharmacy closures, mixed bag, clearly. However, I will say that I've read that, and I would understand that, just so you know, the pathway, complete pathway of USP was released November 1st, 2022, after at least 5 years of revisions. And when it was released, it is more stringent in every category. I'm not sure for all the people reviewing, I'm sure that there are some, but in order to read USP and see what those requirements are, you do have to purchase the documents, under USP, okay? So in order to really read what were the newer, stricter requirements in USP 797, sterile compounding, stricter requirements, USP 795, non-sterile compounding, stricter USP 800 really did not change. That had been in place for a while. And then USP 825, brand new, radiopharmaceuticals. We've essentially almost had no comment or discussion about that. So those requirements, it was quite the leap for facility requirements, environmental sampling, increased frequency to like monthly. There's really a lot there. Your training, your competency of your compounders doubled. There's a lot to take on with the new regulations. That was proposed in November 1st, 2022, with a national implementation date of November 1st, 2023. So there are some areas where a pharmacy depending on their environmental or their facility situation, they have to invest in the changes that are in USP 797 in order to comply. It's nothing to do with any of these regulations. It is the document. So the whole point of the document was to kind of increase the safety and surveillance of your compounding areas, your compounders, everything around the product. They introduced new categories. So if we're going from non-sterile to sterile, depending on your category, 2 or 3, but category 3 is more stringent. And so, all that to say is that there are other reasons, and, it's multiple, but why pharmacies may have stopped their sterile products. That is a very hard reality of this USP document. But again, I just want to reiterate for most of the commenters here that these regulations, I've, been very fortunate to have been part of this discussion and in the review of all comments, all staff documents, feedback, and the proposed regulatory changes. It is really, I'd say, a great honor to me to be able to be in this position, and I take it very seriously. And so I think I'll just end my comments there.
Thank you, Renee. Thank you for your comments there. Then we're going to go to Jeff.
So since I've been involved in this board for the last year, I come to these meetings with a pretty good plan in my head of where I'm going with what I believe where we are in the rulemaking process. And my mandate is to help protect the public. And I've switched course on a few different occasions, feeling like I've done my homework and I know where I'm headed. And I come and listen to public comment for many hours. And my mind has changed because very often I'm looking out for the public and feeling like the information that I have is changed. And that's a struggle for me, right? When I really believe that the package a year ago, it was intended to create a clear path forward so that we could have the policies to be able to sterilely compound things off the bulks list that didn't have a drug monograph. Like that's an important thing, being that I have a son, a 30-year-old with special needs, and I'm a believer in possibly using medications or I'll just say medications that aren't necessarily based on Western medicine. And that's probably more information than I need to give on that. But I'm a believer in access for things that might help, even though it's not a drug, if that makes sense, coming from the Board of Pharmacy, right? So I was really stoked in that the fourth modified text for 1739.6 really had almost everything removed, so that it could be easier to produce these medications at a sterile compounding pharmacy for increased access. I struggle with the fact that doctors and others mention that it's already difficult to be able to access these medications, and why. Maybe somebody on the board can help me with why or what is the roadblock that would allow a doctor to write a prescription for an at-home use for any one of these medications. I know we always focus on the one, but anything. What's the restriction, or why is that a thing? I don't mean to be putting you guys, but you're the experts that, and this is the one time I can talk to you guys about my questions. Is there somebody that can help me with that? I don't mean to be.
So Jeff, I'm not
Sure on you.
I'm not an expert. I don't, I think Maria and Renee may be able to talk better, or Anne, but we don't just, as far as I know, we don't say that they're available without verifying very clearly that they're available. I know that board staff have reached out to a pharmacy to confirm they do have this available, and they gave us a pretty clear written response. They do have it available.
No, I understand. And I don't mean to be, putting you on the hot seat, but there has been doctors talking about how they're unable to write a prescription or obtain these materials for at-home use, which
I
is
think
over
that
and above.
you can jump in there, and I think the distinguishment there, Jeff, is that there is right, so there's a variety of layers of using prescriptions, and I think the doctors use certain medications in office, and then there are at-home use, aka you write a prescription, then you get it at the pharmacy like how you would. So that's the distinguishment. Go ahead, Anne.
I think that one of the things, there's no requirement right now in pharmacy law for people to necessarily tell us all of the products, right? So I can't speak to the full world. What I can tell you is that I'm aware of a letter that was sent to the oversight committees of the Sunset, and from a company that confirmed that they produce both for in-office dispensing and for patient-specific compounds. And they, so that's a public, it was shared with the oversight committees, and they affirmed that they, do, and that they do provide it patient specific. I would also just say that I have seen data as well that also shows that it is. We don't post this kind of information, like the names of companies, on our website, right? It could be misconstrued as an endorsement. But I will tell you that I've seen data, and then I do believe that the letter to the oversight committees confirms that as well, should that be helpful information.
Yeah, I wasn't intending to,
Sorry.
Sure.
Can I add in? I think on I'll just take a kind of one view of why it may not be available for in-home use, because it has to be made in a pharmacy, compounding pharmacy, that has the, whichever they do, category 1, category 2, or category 3, what their beyond use date is.
Oh, and Renee's referring to category compounding, not the
sorry.
category one substance. This is this.
So USP
You're just
has,
trying to confuse
yeah,
me now.
I know. So USP 797 defines its products under category 1, category 2, or category 3. So it's somewhat about your environment. So category 1 is not an actual clean room situation. It's like segregated area. Okay, so the
For
most
use or when it's being produced?
so for when it's being produced. So I'm just talking about the actual compounding. Okay, so a segregated area can have a maximum room temp of 12 hours and refrigerated 24 hours. So, but if you have a clean room suite, then that's where the range goes. So if you terminally sterilize it versus start with a sterile product, there's just a range of beyond use states, again, spanning category 2, category 3. Category 3 has a lot more stringent requirements around it, also gets you the longest beyond use date. And that's would be, applied to like a 503A pharmacy. So like a local compounding pharmacy. An outsourced facility, 503B, they operate under good manufacturing practices, GMP. They have long expiration dates because they're, well, based on their own stability and sterility studies, but they have, as a result, longer beyond use dates. So that's why you can get products from a 503B that has much longer expiration than if you were to make it. Our instance in our pediatric institution, there are lots of products that are made in-house in our category 2 pharmacies. But we also purchase 503B products because they have a much longer beyond use date for other applications in the hospital that without their use creates a lot more work, because of the shorter dates. So, I mean, my take a little bit on, at least for why they may not be available locally for in-home use, is the environment that the compounding pharmacy has for compounding. And like, I'll just harken back to the facility requirements of USP 797, not in the regulations, 797, for what is required for your facility, your staff training, your environmental testing and monitoring, your equipment recertification, all of those things, your HVAC requirements. So they, had to be meeting all of those, and then they can get these products. So I think that's it's rigorous, but again, it's because of the quality.
I'm a big proponent for obviously purity and ensuring that anything that's being used for California consumers is going to be pure and safe. And I mean, I know the proposed regulations, this was in a previous presentation that was presented to us, and it was basically a question, right? Do the board's proposed regulation ban compounding of substances such as glutathione and methylcobalamin? The answer is no, it's not banned. But the proposed language establishes provisions for compounding these products while focusing on purity, quality, and stability for California patients. That to me sounds legitimate and appropriate. But the numerous questions about availability is always something that I struggle with. If it's already so hard to get, and the fourth proposed language took out a lot of that extra, I can't speak to exactly the requirements that removed, other than the fact that it's green and highlighted, and there's a whole lot that was removed out of there as to make it easier to move forward. I still struggle with access. If, even though the FDA had an issue with glutathione and voted, it wasn't a unanimous vote to keep it on the bulks list. People are using it, and there's obviously a lot of people that are swearing by it. And I just want to ensure that we don't limit the access to this thing. And so I I come into these meetings thinking that this is the path forward, and then I hear doctors and other people talking about that this limits access. And so I'm just trying to get a clarification. So if anybody can help me out with that, this is a good time.
I can add one more thing just to what Renee said is the regulations themselves, current, the proposed regulations will not change the access problem that's out there. And
What can be
because
done to
what
change
the access problem, I believe, this is just me speaking, is a result of many things. Some of it's business practices. A lot of it is USP changes that now make compounding much more difficult with the 2022 version that came out that became effective in 2023. Compounding has a lot more steps in USP. It also has many more steps for sterile compounding. And then you take on top of that, using non-sterile products and making a sterile product. USP is very specific about that and how that works. Your local pharmacy down the street that maybe makes ointments or pills or hormones or those kinds of things may decide that I'm not going to make sterile products, or I'm not going to make sterile products from non-sterile components. They make that business decision because it's a lot more regulations, it's a lot more steps, it's a lot more testing, it's a lot more training, and it takes a year to train somebody. You can't just pull someone off the street. So it's just a lot more stuff. So they may have brought down their compounding practices to be lesser, to say not working with non-sterile products, to making sterile, not making sterile products at all, or not compounding at all. I mean, there's been no survey that says, why aren't you compounding anymore? But that may be a reason why that's not available. I have used compounded products myself and my family. I have researched and found, sometimes I found at one point I was using a pharmacy from Utah. The last place was actually a pharmacy that was in the Bay Area. So you do try to find something that's a little bit closer because it's more convenient. But it's very complicated as to why a pharmacy chooses to continue the higher risk of compounding sterile products from a non-sterile component. You're not going to necessarily find that down the street. You may not even find it in your town. Hopefully you could find it close by or somewhere that is available. And what we've found is there are fewer places, but there still are places. The problem is distance is an access issue, and then the number of pharmacies is an access issue. Those are all valid issues, but the regulations don't change that. And so I think that it is very complicated in that stating these real concerns are being impacted or could potentially be impacted by our regulations. It is not true. Our current regulations actually don't allow a pathway forward. This introduced more information that allows more information or more of a pathway forward, but it still becomes a business decision. And you need a lot of expertise to do sterile compounding, and then added expertise to make a sterile product out of a non-sterile product. It is a very unique and very focused area of practice.
Interesting. I know that the FDA uses enforcement discretion because because there's not a clear path forward, and this is supposed to help with that. I definitely struggle when we hear underground enforcement, activities, which, I struggle with. I can see where I don't need to get into my personal feeling of sometimes when policies or people that are doing enforcement, we would want them all to play by the same rules and have very clear information to be able to base their not judgment, but their enforcement on. Very clear steps as to what the regulations mean and say and everything else. And so when you hear things like, there's this dark side of, people working against, I struggle with that because I guess it's because I wouldn't want to believe that, but I don't know. I mean, I don't have anything to base that on other than the fact that I've heard that and we heard it today. I struggle with that. And, you know, I think purity, quality, and stability are important for our people. I already stated that as well. So I guess that's where I'm at. You know, I always look to you as the experts to help me with additional information, to help me with my decision. And every time I come in here feeling one way, and by the time it's time to vote, I feel another way, and I struggle with that because bottom line is, I'm not a pharmacist. I'm a California consumer that has a son with special needs, and I'm looking out for him and the rest of the California population. And so I struggle with this. This is definitely not a self-serving position or things that we're acting on something that's only going to protect us. Like, it's just not the way it works. I guess that's the end of my comment.
Thank you, Jeff. Very helpful comments there, Jeff. Really, thank you. We're gonna go to Ricardo. I know you just got into this, Ricardo, but you are a seasoned member,
Yeah,
so
I know Jeff's had a little, you've had the struggles listening to the public, listening to the experts that we have here. Well, I've only had several days to research, and I've been, you know, trying to catch up on this. Also, being a police officer and state investigator for, you know, 36 years is my background. So I feel for the firefighters because I work with them also. So it's hard for me to sit here and, you know, vote on one way or another on it. I thought I was prepared. I researched, and it's been great giving me the information. I've spoken to some of the experts, and but there seems to be a disconnect, you know, with the public. At least the comments that we're getting, I just feel they're not getting it's not getting across the information that we're trying to provide to them. I know I've always admired Maria here. She's our expert. She's always put the information out, but it just feels like it's not getting across, and I can feel it from the public. And if that's what we're trying to accomplish, to work with the public and make this better, I think we have to work on that. But I don't know, I just want to get my 2 cents in. I'm less prepared than Jeff, or not to say prepared, but I need to catch up a little bit more. That's all. That's what I wanted to point out. Thank you.
Thank you, Ricardo. We're gonna go to Satinder. Satinder.
I don't think I have that much more to say than what's already been said. I would do want to say is that yes, compounding is a very important part of pharmacy profession. It's been one of the oldest. Most of us, you know, had that in training in school. So I think this is one of the, I say, regulations that I've seen goes this far to, like, especially listening to all the feedback, and there've been tremendous number of changes. And I think, you know, hard work that Ria and Ernie have done, there's been a significant number of changes. And I feel like we created a path forward for the bulk compounding that wasn't there. It makes it available that it could be compounded. So that's all I wanted to say.
Thank you, Satinder. I'm gonna go to Maria next.
Thank you. Really hard to kind of summarize what we've talked about over this last year as a board and over the last 5 years as a compounding committee and as the board. At one point, I think Ricardo was on the compounding committee in his previous life. So he was around when we had all those big forums and public comment where we had days and days of discussion in Southern California and in the Bay Area. And we had members of the public talking about compounding when we first started and then restarted the process. The only thing I want to say is our regulations are to clarify and make more specific federal law and USP. and taking that into account is USP has had dramatic differences. And so our current regulations are causing problems with licensees because they often our current regulations are not consistent with current USP. And so this has been going on for 2 years. Our original goal was to have regulations updated close as possible to the November 1st, 2023 date to help licensees. And in fact, she hasn't testified this meeting, but in a previous meeting, one person testified that they were anticipating having problems sending their compounded products to other states because of California regulations causing conflict with other states and how they apply it. So that was a business concern that she had. The main thing to comment on is most of the public comment is about the Category 1 bulk substances, which we have emphatically stated are not banned. And if you look at the regulations in the green, sorry, wrong color, they've been dramatically streamlined to help what we thought would be to help with the confusion and the concern that there were additional regulations. And so basically it's saying follow federal law and USP, and you can use these products in California. Current regulations don't say that you can use the products in California, which we know is not appropriate because there is a need and there is a use. They don't address access. The regulations also don't affect what the FDA has approved. So the FDA has let us all down, I've said this before at a previous meeting, by leaving these few substances on this gray list, which is not approved but not disapproved, calling it under evaluation. How long is it going to be there is quite shocking to me as a citizen that something can be ignored and left in this gray zone for such a long time. It's just not right for patients and for the physicians who care for them. And that's what all of our discussion has been over these last few months. When you look at it, and I hope that people have had an opportunity to look at all the other positive things that are in these regulations, there are guidance and increased flexibilities to pharmacies to do non-sterile compounding, to make chemotherapy, to save patients who have cancer, to make radioactive medications. There are so many details about those things, and also sterile products. There's a lot more flexibilities allowing facilities to transfer their competencies between facilities, thereby saving time and money and training. There's immediate use provisions which allow for patients to continue to receive medications should a facility have problems with their facilities or their equipment. These things are not in current regulations. There's so many wonderful things in the regulations, and when it comes down to clarifying them, I think we have spent a lot of time discussing these nuances and these details with all the stakeholders. And in fact, the one area that is the most heard in the verbal testimony is about Category 1 bulk substances, which the regulations do not ban. And if you read the regulations specifically, it says to follow federal law and USP guidance. That does not change access. I understand access is a problem, and we don't have anything in the regulations that decrease access or increase access. USP sounds like has decreased access because of increased quality standards. And that is something that should be looked at more closely as to how can we provide information, educate, maybe provide incentives for people to look more at compounding tools, whatever. It's just so complicated that some pharmacies, I understand, have said, this is too complicated. I'm so much at risk. I'm not going to do it. Or they take the time and spend hundreds and hundreds of hours reviewing the regulations themselves to become an expert. There are some people, and there's one person in the audience here who has done that, but that's very rare. And it's because this is a complicated area. But just to reiterate, our regulations do not ban the substance and they do not decrease access. The access issues really have nothing to do with our regulations per se.
Thank you for the comment, Maria. Then I'm going to go to Nicole. Nicole?
Yes, thank you, President O. I think most of the things I would have said have been covered. This has been a tough topic, I think, for everyone, but I felt personally close to it as a person with a chronic illness myself. That being said, I definitely want to kind of reiterate what Maria was saying in that I think particularly the third modified text, and nothing changed about it from the fourth, where we went to a standard of care model for those category 1 bulk substances, really took away most of the concerns. We're not being prescriptive. We're giving people that space. And with that standard of care model, we're giving it room to kind of adapt over time as the needs develop and as the compounding as a whole develops. So I was really, really pleased with that change. I was really hoping people were going to talk specifically about that change here today, but I feel like people are still referring to like a previous version for the most part. So that was a little bit disappointing. I don't know if it was not understood what that changed or just that, we've been talking about this so long that it's hard to, stay on the current version. The other thing I would reiterate that Maria said is, no one's trying to take away access, and it's not even about any specific drugs. It's literally just about making sure that any drugs that you take are safe and clean. And, as a person with a chronic illness, I take compounded drugs. I do not take sterile compounded drugs because as a pharmacist, I am very aware of the risk. And not to say I couldn't find somewhere to take it, but that's always something I'm nervous about with a compromised immune system. It seems more risky to take something that was a sterile compounded product. So it's a choice I choose for myself. But it's our job as the board to make sure, even if it's a rare thing that these happen, to Renee's point, it's deadly when a sterile product is not sterile. You likely won't have that person here to tell you about it because it's very, very risky. So this is it's a very complicated and long process, but I would like to thank all the commenters and all of the board staff for this back and forth process. We know it was very long, and to Trevor's point, I was one of the people who probably made it longer because of my questions, because of my concerns, and that wasn't meant to be a bad thing. It was just meant to make sure that we had more time to hear you all. So anyway, that's all I have to say. Thank you.
Thank you, Nicole. All right, members. Let me close by highlighting a few areas of this long journey that we've all taken together. I said this, but I'll say it again. I have personally voiced my very strong desire to ensure Category 1 bulk drug substances remain accessible. I have been saying that for many years, ever since I was appointed to this very board. You can look at the recordings. All the meeting recordings are available in public. I believe we have made our voices very clear again, and is expected the direction we have made it is clear, will be translated into the actions by staff. I'm well aware of and ponder with so many areas of pharmacy practice that I struggle with every day with operating a pharmacy. Many pharmacies under tremendous amount of stress for just to stay open and survive. I'm well aware of this. And I'm saying this because, as you all know, the board is a consumer protection agency, but this is really where the access becomes truly instrumental point in our decision-making because access is consumer protection. Access is important, but also business decisions are very difficult to navigate for our perspective. Just want to say that before I also summarize this long journey that we've all taken together. It is important to highlight some of the significant changes made through this rulemaking process, which was noticed in the back of April of 2024. While I will refrain from describing all of them, I would like to highlight some of the big changes that we made. specifically related again to sterile compounding with bulk drug substances on the FDA Category 1 list. As initially noticed, the regulation would have only allowed for such compounding based on approval from a public health officer during emergencies and through the rulemaking process. Changes have been made significantly, most recently. The fourth modified text no longer requires facility to do specific tests. Rather, facilities must follow federal law, federal guidance, and national standards and have policies to show how they will follow the laws and standards. In response to comments, the board has also made significant changes to provisions related to compounding for animal patients, expanding the day supply pharmacies can provide to veterinarians for dispensing, again, for dispensing purposes. In response to comments received regarding compounding in hospitals, the board has modified the regulations to provide additional flexibility for hospitals to compound commercially available drug products, expanded provisions for immediate use compounding, including when equipment or environment fails, allowing the transferring of competency assessments across compounding locations, just to name a few. In response to comments received, the board significantly modified the proposed regulation text related to the handling of hazardous drugs. The fourth modified text now provides that the regulation only apply to facilities compounding hazardous drugs, and in some instances, facilities that crush hazardous drug tablets or that open hazardous drug capsules. The board also removed language regarding pass-through doors and modified provisions related to changing gloves. The last significant change I would like to highlight is specifically related to the use of flavoring agents. The fourth modified text provides that facilities only compound by adding a flavoring agent to an FDA-approved drug generally do not need to follow the board's compounding regulation, CCR 1735. Further, pharmacists can add flavoring without approval from prescribers or prescribers' agents. Lastly, and most importantly, I reserve the right to modify the regulations as we move forward with this process in a future rulemaking. I'll ensure that we will embark on post-implementation review on all these rules and evaluate what opportunities exist in the future. These are not the texts that will live for 10 to 15 years. I'm pretty certain of that. We'll update them, and I'm sure much sooner than that. With that, this has been a long journey for everyone involved. I would truly like to commend and thank all stakeholders engaged in this process, voicing your thoughts and sharing your ideas. I would also like to highlight and truly appreciate the time and commitment for all board members, especially Maria and Renee. Also, I would like to thank sincerely to board staff, DCA council, and everyone involved in this process. I truly, truly appreciate and sincerely thank everyone's time and commitment for all your dedication to California and your mandate for protecting our mandate for consumer protection and making that truly your priority. And I just cannot thank everyone enough through this process. Okay, members, with that, I'm going to call for vote, and I will open up one last time for anyone to say anything. All right, with that, I'm going to vote first. I vote yes. We're going to go to Trevor. Trevor, how do you vote?
Yes.
Thank you, Trevor. Renee, how do you vote?
Yes.
Thank you, Renee. Jeff, how do you vote?
Yes.
Thank you, Jeff. Ricardo, how do you vote? You could abstain. It's okay.
Yeah, no, I know. I just, again, I don't think it's fair to the public for me to just come in and sway it. I'll have to abstain on this.
Thank you, Ricardo. No problem. Satinder, how do you vote?
Yes.
Thank you. Maria, how do you vote?
Yes.
Thank you, Maria. Nicole, how do you vote?
Yes.
Thank you, Nicole. Thank you, everyone. It's 11 o'clock, right on the dot. So we're gonna take a break for 15 minutes. Then we're gonna go to next agenda item 3, public comment for items not on the agenda. We'll come back at 11:15. 11:15. Thank you, guys. Annie, 1, 2, 3, 4, 5. We're not gonna be able to start. We're gonna have to wait a little. Oh, Nicole's back. But then don't we? It's awkward. But she has to then announce. Corinne, I think we have to wait until somebody comes back, right? Because we have to have at least 6 in person. 1, 2, 3. Because if she is 7 to have water, coffee. Okay, well. For anyone, we're just wondering, we're not wondering, we're waiting on one member to return. So we'll start as soon as a member is back so we can have a full quorum. Oh, there, she's walking back. So you just leave it unmuted. All right, I'm going to get started on taking roll call. Trevor?
Present.
Thank you, Trevor. Renee?
Present.
Thank you, Jeff.
Here.
Thank you, Ricardo.
Yeah, present.
Thank you, Satinder.
Present.
Thank you, Nicole.
Present.
Thank you. I'm here. And Maria? Just run to the microphone there.
Here, apologize.
Thank you. All right, next agenda item 3, public comment for items not on the agenda for future meetings. We'll now accept public comment for items not on the agenda. You're not required to identify yourself, but may do so. I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the board and members of the public. I can't speak today for some reason. Members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. We'll begin with Sacramento. I don't see anyone here. We're going to go to WebEx. Moderator and WebEx, please.
Certainly, if anyone has a suggestion for a future agenda item, you may describe it by using the public comment feature. You can click the hand icon to raise your hand. Our call-in users can press *3 to raise your hand. And if you're on a mobile device, the hand raise might be behind the 3-dot other options feature. So it looks like we do have a raised hand from call-in user 16. So I'm going to send you a request to unmute your mic, and you will then press *6 to unmute. And call-in user 16 from the 559 area code. I'm going to send you one more request, and then as I send it, it should let you press *6 to unmute your phone. There you go. You're unmuted. Go ahead.
Hello, this is Dr. Seha again. I just wanted to request that now that the board has passed these regulations, that you really focus on enforcement. I know Dr. Serpa had mentioned that she was pretty adamant that these regulations had nothing to do with the lack of accessibility, which is what I had made a comment about earlier, when that seems kind of unlikely given that this board directly oversees enforcement and has fined several compounding pharmacies and effectively shut them down. I've seen somewhere and heard from people that fines are upwards of $100,000, which is not really feasible. At the last board meeting, it was mentioned that the discussion around making sure that these compounding pharmacies are up to date are generally ones where regulations are given or advice is given to help these compounding pharmacies be able to meet these new pretty stringent requirements, but that doesn't seem to be the case that actual compounding pharmacies are experiencing, and that has directly correlated to the lack of accessibility in California specifically. USP 797 is at a federal level, and other states are not having the same level of accessibility issues as we are experiencing here, as has been communicated to you by several professionals who are in the field trying to get accessibility to this product and in active studies as well. So now this is kind of the board's responsibility and the board members' responsibility to make sure that we're looking deeper into enforcement and how these things are being fined and regulated at our state level. Thank you for your consideration.
Thank you for the comments.
And I do not see any other requests to comment on future agenda items. Shall I close the public comment feature?
Yes, please. Thank you, Moderator Ann. Thank you. Now bringing the discussion back to members, are there any items you would like to place? Oh, Albert, come on over. Thank you, Albert. Albert Wong, the formal board member.
Well,
Exciting
hello
to see.
everybody. It's very interesting. I come back and sitting on the down here instead of up there. So my on. Anyway, seem like that's a communication problem. I mean, hearing what you guys saying today, like before, we have seminar for which inspector give us the seminar on how to prepare for inspection. Why can't we do the same thing for the compounding? Have a seminar for all the interest group, then you teach him how to, how to do it properly, safely. So so everybody able to, I like to, what I always feel that we are consumer protection and safety. We don't care how you do it, as long as we do it, meet the goal and objective, and that's what we want. It's not something hit you on the head, you say, that's a fine, $100,000. That's not what we're here for. We're supposed to help them to do the right thing. So I suggest that you guys have some kind of seminar to teach them how to do things properly. Then it's make it accessible to everybody.
Thank you. Thank you, Albert. All right, members, do we have any comments, suggestions? I'm sure we'll have a lot of work ahead of us with our Communication and Public Education Committee as well as Enforcement Committee on how we move forward. Do you have something, Maria?
I think since we can't discuss it, that
we can
better opportunities for education and communication and providing some sort of access and tools to licensees about the complex nature of compounding could be something that either the enforcement committee could discuss, or we could ask staff to put together a 2 or 3 hour CE. I'd be amenable to either.
Okay, sounds good. Don't kill me, Ann, but I'm gonna also bring up possibility of discussing maybe at, I don't know which committee this would be, but if there is an opportunity for pharmacies could self-report compounds they compound on some ways. So that I'll have to talk to Ann, but if members, do you think that may be also something that we could consider, like, because we do have currently a website, an our board website that has what's called health registry that allows pharmacies to self-report what services they provide. So it would be kind of similar to that. But I wonder if That sounds like something we could talk about at least. Go ahead, Satinder.
Yeah, I'm in favor of that. I think that'd be a really good, useful resource for public, as it came pretty clear that accessibility and was one of the biggest concerns. And if we can anyway identify and help in that regard, that would be great.
Thank you. All right. Anyone else? Any other
President, no,
thoughts?
it's Nicole.
Oh, sorry. Go ahead, Nicole. Sorry if you raised your hand. I'm sorry.
No, it's okay. Yeah, I just wanted to propose that we look at accessibility overall, not just around compounding pharmacies, but we're starting to see a lot of just regular pharmacies close.
Yes.
And I'd
Mhm.
love if we could dedicate some time to looking into that, both compounding and non, and see what factors might be modifiable to the Board of Pharmacy where we could help. I know a lot of it's out of our control, but I'd like to research that further.
Sounds good. I think that might go to licensing. We'll have to think about it. But thank you. Thank you, Nicole. All righty, everyone. I think that is the end of the road for today. Thank you, members, again, really for your adjusting your schedules to accommodate this meeting today, for all you've dedicated your time. We've had 7, 8 meetings in the last 6 months or so. So just truly appreciate all of you. We do not have closed meet session today. So today, this is it. We will see you all at April 9th through 10th board meeting. Meeting is adjourned. Thank you, everybody.
Thank you. Bye.
This is the meeting moderator. The meeting has now ended. Thank you very much.